But when these numbers go down, doctors fear other critical figures will skyrocket at the cost of more lives. According to doctors, the COVID curve is altering the cancer curve. After doctors found this small nodule in Harla Hutchinson's lung, the never smoker decided to move forward with surgery, even during the COVID-19 crisis.
Of course, I was a little concerned about that, but I did ask about it.
She even got a second opinion. The consensus?
It's better to go ahead now because it could be, 6 months or more before, if you're trying to wait this out, it could be 6 months or more, and you have no idea. Right now, at that time, it was a tiny little nodule. In an easily accessible location, and who knew what would happen if we just let it sit there.
On April 22nd, Harla underwent a robotic procedure to remove the lesion, which turned out to be cancer.
I felt really lucky that they had caught it early. I don't know how fast it would have grown if we'd left it. I don't think I would have wanted to be waiting around for 6 months, feeling like I had a time bomb in me.
We really don't know at this time what true societal impact on COVID-19 is going to be.
But Northwestern Medicine thoracic surgeon Dr. Samuel Kim does know the numbers. And when it comes to lung cancer versus COVID, waiting it out may have changed Harla's prognosis.
The true mortality, as far as we know, according to CDC, is anywhere from 0.4 to 0.8%. From stage 1 to stage 2 cancer, if you let it get bigger, there's about 40% or 30% increase in mortality. So I think that, really we have to get everything in perspective.
Since the early days of the pandemic, Dr. Kim says his patient caseload has gone down 50 to 60%, with patients opting to forego visits and screenings until COVID cools off.
I just actually saw one of the patients. Because of the COVID, this patient was very afraid to get an operation, and we made a decision to repeat a CT scan. So I saw this patient back in March, and then we repeat a CT scan now. There was an interval growth.
I sort of felt like if the doctor was confident that this was the time to do it, that I should be confident that it was the time to do it also.
Harla was tested for the virus before her surgery. She was negative. And there are precautions in place at the hospital, including thermal temperature checks for employees. Measures, Dr. Kim says, have helped prevent infection transmission among his patients.
If we now postpone any of this operation longer, I'm afraid that we're going to convert early lung cancer into late cancer, which has a significant impact on the prognosis. So what I'm afraid is that if we don't deal with this problem now, we're going to have a second epidemic or pandemic problem, non-COVID related death, that's going to really haunt us toward the later part of the year.
I was very reassured that, of course, there was no way to know entirely that you weren't being exposed, but I was very reassured by all the precautions that they were taking. And I was hardly in the hospital at all.
Dr. Kim says smokers and former smokers 55 and older should get a lung cancer screening with a CT scan.